Welcome to the Wolffpack Fitness Podcast with your host, Adrian Wolff. I'm a PhD student in interdisciplinary health sciences with a master's degree in kinesiology and a bachelor's degree in psychology. I've been a fitness coach for over 10 years and I've trained everyone from everyday gym goers to kids to Division I collegiate and professional athletes. My mission is to provide you with actionable knowledge in the areas of fitness, nutrition, stress management, and psychology to help you live your best life every day. Let's get to the show. What's going on, Wolffpack? Welcome back to another episode of the Wolffpack Fitness Podcast with me, your host, Adrian Wolff. Last week's episode was a really good one. I had Flex Wheeler, one of the best bodybuilders in the history of the sport, on the show, and we talked for quite a while. It was really inspirational and I learned a lot. If you're going through some sort of struggle in your own life, it's definitely one you want to listen to. It's also available on video on YouTube, Spotify, and Apple Podcasts. So go check it out when you're done listening to this episode. Speaking of the show, if you're liking the content I'm providing, please pause this episode, follow my podcast, and submit a quick rating if you're listening on Spotify, or a review if you're listening on Apple Podcasts. Also, don't forget to share this podcast with your friends and family. I want to thank you for continuing to listen and helping me grow my podcast. Before I get into the episode, I want to make it known that this podcast is separate from my teaching and research roles at the University of Nevada, Las Vegas. In this episode, I discuss some important information about lower back pain that has been discovered through scientific research and how it might apply to you. I also help you understand the differences between specific and non-specific lower back pain and which type you might be dealing with. Then I get into a really informative study where researchers implemented an exercise and stretching intervention to see how it impacted their patients' lower back pain. I finish up by explaining the strengthening and stretching protocol they used and how you could use it for yourself, whether or not you are struggling with lower back pain. I want to start off by giving you some background on low back pain. Chances are good that either you or someone you know is currently dealing with or has had chronic lower back pain at some point in their life. It can be very difficult to live with, and in some cases, it can be so bad that it's debilitating, and it makes it difficult to go about your daily activities without being in serious discomfort. According to research conducted in the year 2000, lower back pain is experienced by 80% of people at least once in their lifetime, and approximately 10% of these cases are more serious cases of lower back pain, like the following: lumbar spinal stenosis, which is a narrowing of the spinal canal in the lower back through which the spinal cord travels. This can put pressure on the spinal cord and the nerves that extend into the legs and cause pain, numbness, and weakness in the legs and glutes, which are your butt muscles, and it's often made worse by standing or walking. Spondylolisthesis, which is a condition where one vertebra in the lower back slips forward over another. This can cause lower back pain, leg pain, and muscle spasms. Fracture of the spine, which is a break or crack in one of the vertebrae of the lower back. Inflammatory diseases, which is a group of conditions that contribute to inflammation in the lower back, often leading to pain and stiffness. Examples of these include ankylosing spondylitis or spondyloarthritis. And another one of these more serious cases is nerve root compression, which is also known as lumbar radiculopathy, and is when a nerve root coming out of the lumbar spine from the spinal cord is squeezed or irritated, often causing pain, numbness, or weakness in the leg. The compression can come from herniated discs, spinal stenosis, or bone spurs, which are abnormal bone growths. So these are some of the more serious conditions that need specialty treatment to address, and they are categorized as specific low back pain. But many more people suffer from chronic low back pain that is less severe but can be just as agonizing. This type of low back pain is known as non-specific low back pain, where the cause cannot be clinically identified. For this type of non-specific low back pain, Core stability exercises are generally used to treat it and reduce or eliminate the pain. When the core muscles are weak, core stability exercises can help stabilize the spine, and they're often used with hip exercises, especially in people who have accompanying hip joint pain. A concept known as the hip spine syndrome was introduced about 30 years ago, and it's commonly discussed in the scientific literature. It assumes that there is a clear disability in the hip joint and the lower back, and when exercises are employed to address either the hip or the lower back, they can improve pain and function in the other area. It's common to think of the lower back and hip as independent areas of the body that have different functions, but they are more closely connected than you might think. So dysfunction in one area tends to affect the other area. It's important to understand that everything is connected in what is known as a kinetic chain, which means that movement in one area of the body is connected to movement in adjacent areas of the body up or down the chain. Although muscles perform different functions, they are still connected through a structure known as fascia. So if there is dysfunction in one muscle group, it will negatively impact the function of another muscle group up or down that chain. So what you commonly see in people with non-specific low back pain is also hip joint pain, stiffness, or reduced range of motion. A specific example of this that has been shown in research studies is that people with low back pain commonly have weaker hip abductors and extensors compared to people without low back pain. Your hip abductors are the muscles on the outside of your hip. You may have heard the terms gluteus medius or glute med used before to describe them. And your primary hip extensors are your gluteus maximus, or your big butt muscles. If these muscles are weak, along with key core muscles like the multifidus, transverse abdominis, and internal obliques, your hamstrings, which are the long muscles on the back of your thighs, can activate at inappropriate times to try to compensate for the muscle weakness, and this can further exacerbate the problem. To add on to this, there is a muscle group in the front of your hip known as the iliopsoas, which is a combination of the iliacus and psoas muscles. These two muscles are your primary hip flexors, and if they're overly tight, they can pull forward on your lower back, specifically the psoas, and this can further reduce the function of your core muscles. But it doesn't stop there. Two other critical hip muscles have also been studied for their contributions to lower back pain. They are the tensor fascia latae, or TFL, and the piriformis. The TFL is located on the outer front portion of your hip, and the piriformis is a muscle deep or underneath your gluteus maximus, and the piriformis is responsible for rotating the hip. If these muscles are tight, they can also reduce hip joint range of motion and rotation. So you can see just how complex non-specific lower back pain can be, and how much can be involved in figuring out which muscles need to be stretched and strengthened. But the good thing is that all this research has shown common patterns in muscle dysfunction that can definitely be improved to help fix your lower back pain. A competent physical therapist or personal trainer can also perform something called manual muscle testing, or MMT, and active or passive joint range of motion testing to assess which muscles are tight or weak and which need to be strengthened to focus more specifically on the primary contributors of your lower back pain. As I mentioned earlier, core and hip muscle strengthening exercises have been shown to reduce lower back pain and improve low back pain disability, muscle strength, and balance, and have been shown to improve patient satisfaction when stretching was used as well. Stretching can be used as a potent method for preventing injury, but it can also be very effective for reducing lower back pain. And when it's combined with hip and core strengthening exercises, it can be even more effective at improving lower back pain. I want to get into this specific study where the researchers completed an intervention that emphasized core strengthening exercises and hip muscle stretching with people who had non-specific lower back pain to see how their conditions improved. This particular study was published in 2020 in the Journal of Experimental Medicine. The researchers recruited a total of 66 participants, 34 men and 32 women, between the ages of 30 to 65, and they all had non-specific lower back pain for at least 3 months. The researchers split up the patients into 3 groups. The first group was a stretch group, where they completed 30 minutes of core strengthening exercise plus 15 minutes of hip muscle stretching. The second group was a strengthening group, where they completed the same 30 minutes of core strengthening exercise plus 15 minutes of hip muscle strengthening. And the third group was a sham group, or a control group, where they did 30 minutes of the same core strengthening exercise and a gentle palpation of the skin, which does nothing. This was simply the group they compared to the other 2 to see if the interventions had an effect. What they found after the interventions was that all the groups saw improvements in their lower back pain intensity, lower back instability, hip muscle flexibility, balance, and quality of life, since all 3 groups performed the same core strengthening exercises. This further supports the notion that core muscle strengthening alone will help improve lower back pain and function, hip flexibility, balance, and quality of life. For differences between the 3 groups, the hip stretching and hip strengthening groups saw greater improvements in pain intensity compared to the sham group, and the hip stretching group saw greater improvements in lower back instability and hip muscle flexibility compared to the hip strengthening and sham groups. When researchers see differences like those, they typically want to know what the reason behind those differences is. Why did they see significant differences between the groups? What could have caused those differences, or what were the mechanisms behind those differences? They inferred that the greater improvements seen in the hip stretching group compared to the other 2 groups were due to improvements in the function of some of the key muscles I mentioned earlier in this episode. If you recall, excessive tension in the iliopsoas, the hip flexors, can result in dysfunction of the transversus abdominis, which is a core stabilizing muscle, and gluteus maximus, a hip extensor muscle. And lower hip extensor muscle activation can result in a tighter dysfunctional piriformis, which is a hip rotator muscle. The function of these muscles, specifically how they functioned relative to each other, improved with core strengthening exercises and hip muscle stretching, resulting in improvements in lower back pain and other related symptoms. So what's the take-home message here? If you have nonspecific lower back pain, performing core strengthening exercises will help improve your symptoms. But if you also include hip strengthening and hip stretching, you will likely see even greater improvements in your lower back pain, balance, and quality of life. So let's talk about which exercises the researchers used in this intervention, how frequently, and for how long they used them in their particular workouts. So you can try these for yourself. Also, know that these exercises can be highly beneficial in preventing lower back pain as well. So even if you don't have lower back pain right now, these can be very, very beneficial for you. Here's the list of core strengthening exercises first. I put video tutorial links to all of these exercises in the show notes, so just click on each to learn how to do them. The first one is abdominal hollowing. You lie down on your back with your feet off the ground and knees bent 90 degrees. In this study, they put what is called a pressure biofeedback device under the lower back and had the patient squeeze or brace their core muscles hard enough to exert a certain amount of pressure into the device. But what you can do is imagine that there is a bug underneath your lower back and you want to squeeze your belly hard enough that your lower back squashes that bug into the floor underneath you. The second exercise is a side bridge or a side plank. You lay on your side and prop yourself up onto your elbow and forearm while stacking your feet and lifting your body off the ground, and hold that position. The third exercise is a supine extension bridge or glute bridge. You lay on your back with your knees bent and feet flat on the ground. You slowly squeeze your glute muscles and raise your hips off the ground until your hips, knees, and shoulders are in a straight line. You hold this position, then slowly lower and repeat. Fourth exercise is the straight leg raise from prone or prone leg raise. You lie down on your belly with your forehead on your arms. With a straight leg, you squeeze your glute and hamstring muscles to lift one leg off the ground, hold that position, then slowly lower and repeat. The fifth exercise is the alternate arm and leg raise from quadruped, also known as the bird dog. You get on all fours, hands and knees, squeeze your belly to maintain trunk stability, then reach one arm forward and the opposite leg backward at the same time until they're fully extended, then slowly lower and repeat on the other side. The sixth exercise is the prone bridge or front plank. You lie down on your belly, then support your body with your elbows and forearms while bracing your core muscles and lifting your body up off the ground, keeping your body in one straight line from your feet to your head. Next is the hip strengthening exercises, which are also included in the show notes. First exercise is a side lying hip abduction. You lay on your side with your bottom knee and hip bent approximately 45 degrees. The top leg is straight and rotated slightly inward. You then raise the top leg, hold the position, slowly lower, and repeat. Second exercise is the prone heel squeeze or frog pump. You lay on your back with your heels pressed together. Then you squeeze your glutes and raise your hips off the ground, slowly lower them, and repeat. The third exercise is the quadruped hip extension. From all fours on your hands and knees, you brace your core muscles to stabilize your trunk. Then you squeeze one glute and raise your leg as high as you can toward the ceiling without arching your lower back. Hold, then slowly lower and repeat. The fourth exercise is a standing gluteal squeeze, also known as the pelvic tilt. While standing upright with your feet slightly outside shoulder width and slightly rotated outward, squeeze your lower abdominal muscles and your glute muscles to bring your lower back into a neutral alignment from an extended position. Be sure not to hyperextend or round your lower back too far. Just small, slow, controlled movement. Last is the list of hip stretching exercises. These are also included in the show notes. The first one is a hamstring stretch. You can use a stretching strap or a stretching band, which I've linked in the show notes as well, and loop it around your foot. Then lie down on your back and slowly pull your leg up with the strap or band until you feel a stretch in the back of your leg. The other leg stays on the ground. Second stretch is the iliopsoas stretch. The researchers used what's called a modified Thomas test for this stretch, but you can use what is called the couch stretch. You kneel down in front of a wall that's behind you, then you lift one leg behind you to put it up on the wall, then raise the other leg in front of you to get into a lunge position with your knee on the ground. This is an intense stretch, so start out with the knee a little further away from the wall in the beginning when you're first getting used to it. The third stretch is the piriformis stretch. You lay on your back and cross one leg in front of the other thigh in a figure 4 position. You gently pull the other leg towards you as you relax your head back toward the ground. The fourth stretch is the tensor fascia latae stretch. You lay on your back and cross one leg over the other in a figure 4 position. Allow the weight of the top leg to slowly drop your bottom knee towards the floor and hold that position. So how frequently and how long should you do these exercises and stretches to see improvements in your lower back pain? The protocol is included in the show notes as well. The core strengthening exercises were done for 30 minutes, 3 times per week for 6 weeks. The exercises were isometric in nature, meaning you just hold the muscle contractions for a certain amount of time, then repeat. For each exercise, you complete one set, holding the contraction for 7 to 8 seconds, and do that for 10 repetitions with a 3-second rest in between repetitions, and then you rest for 1 minute in between exercises. The hip muscle stretching was done for 15 minutes, 3 times per week for 6 weeks. Each stretch was a static stretch, meaning you just hold the stretch, and it was held for 30 seconds for 3 repetitions with 10 seconds of rest in between repetitions. The hip muscle strengthening was also done for 15 minutes, 3 times per week for 6 weeks. Each muscle contraction was held for 30 seconds for 3 repetitions with 10 seconds of rest between repetitions. All right, for your action item this week, whether you have non-specific lower back pain or not, go into the show notes and watch some or all of the exercise video tutorials and start implementing them into your daily routine. If you're short on time, you can split them up throughout the week. You don't have to do them all in one session unless you have the time. You can also prioritize the core strengthening exercises and hip stretches to get the biggest return on investment for your time. Leave me a comment about how the exercises worked for you. All right, that's all for today, Wolffpack. If you're liking the content, please follow and rate the show on Spotify or leave me a review if you're listening on Apple Podcasts, and introduce the show to your friends and family. I would also love for you to leave me a comment about any additional topics you would like to learn about in the areas of fitness, nutrition, stress management, or psychology. You can also find me on social media on Instagram at coach_awolf and YouTube at Wolffpack Fitness. Thanks for listening. Go get your action item done and tune in for the next episode. Take care. Thank you for listening. If you like the content, be sure to follow my podcast, leave a review, and check out the show notes for additional details and links discussed in this episode. My mission is to provide you with actionable knowledge in the areas of fitness, nutrition, stress management, and psychology. It is often said that knowledge is power, but I like to say that knowledge applied is even more powerful. Take what you learned today and find a way to apply it to your lifestyle so you can continue living your best life. Thanks, and be sure to activate the new episode notifications to be the first to learn about new and exciting content. See you next time.